Imagine a long time before modern hospitals, scalpels, or anesthesia, a time when ancient civilizations were still uncovering the secrets of the human body. Over 2,500 years ago, an extraordinary physician, Sushruta, was performing surgeries that would shock even today's medical experts. This is the story of ancient India's plastic surgery, a science so advanced that it laid the foundation for what we now call reconstructive surgery. Sushruta, often called the father of surgery, was an ancient Indian scholar and physician. He lived in the 6th century BCE and wrote the famous book Sushruta Samhita, one of the world's oldest medical documents. This book describes over 300 surgical procedures, 120 surgical instruments, and 8 types of surgical techniques, long before the world knew of modern medicine. One of Sushruta's most revolutionary techniques was rhinoplasty, nose reconstruction. In ancient India, criminals often had their noses cut off as a punishment, leaving them permanently disfigured. But Sushruta discovered a way to rebuild the human nose using skin grafts from the forehead. This technique, known as the Indian flap head method, became so advanced that centuries later, British surgeons in the 18th century adopted it as a standard in reconstructive surgery. But how did Sushruta manage these complex surgeries without modern tools? He used scalpels, forceps, and needles made of sharpened stones and metals. More impressively, he had a deep understanding of sterilization, anesthesia, and post-operative care. Sushruta's surgeries were accompanied by a mix of wine and herbal extracts, acting as a primitive form of anesthesia. His use of antiseptics like turmeric and honey helped prevent infections, proving that Indian medicine was centuries ahead of its time. Despite its brilliance, Sushruta's knowledge was nearly forgotten. It wasn't until the British colonizers rediscovered his techniques in the 18th century that the Western world acknowledged the genius of ancient Indian medicine. Today, the principles of skin grafting, reconstructive surgery, and suturing all trace their roots back to Sushruta's methods. Modern medicine pioneered thousands of years ago in India. His philosophy reminds us that true healing comes from within, a lesson as relevant today as it was 2,500 years ago. It's the ancient Indian legacy, one that continues to shape the future of medicine.